Welcome back, Dr. Richard on the screen. We are ready to go. Let's hear about the hippos and the elephants.
Good. Okay. Right. Thank you, guys. Okay, so let's talk a little bit about elephant. You guys have been through all the details and the theoretical implications in terms of who and what elephant have and what they have got in terms of a unique anatomy. So some of these play a role in terms of our ability to anesthetize them safely, our ability to move them around. So I'm not going to go into that in any kind of detail. I think the biggest thing that is of concern or of interest to us really is just size, the specifics in terms of their respiratory anatomy, and how they actually breathe in response to some of the immobilizing drugs that we actually use. So we know about the fact that they are mostly grazers. They take some degree of browse, but they have the ability to modify an area very, very quickly if their numbers get very high. And we also know that within most populations or areas in which there are significant elephant population, that you have some degree of human-wildlife conflict, whether that's here in Southern Africa or in Southeast Asia. It is a big issue. We know that they also have there are very few natural influences or threats to elephant populations, and so their numbers can increase very, very rapidly. So remember too that they are obligate nasal breathers. In other words, they breathe only through their trunk. It then becomes critically important that when you're knocking these animals out, that you pay attention, and I'll show you some slides of how to do it, that their trunk is always open. You've got to modify, or you've got to manage their respiration by listening to the way they breathe, but also just really feeling for the inhalation or exhalation of air through the trunk. So we know that the lungs are fused to the thoracic wall. There's no negative space between the lungs and the thorax wall in elephant as there is in most other mammals. So respiration is largely achieved by the diaphragm with very little influence from rib cage movement in terms of the effects of the intercostal muscles. Very, very small effect. You have the presence of massive abdominal organs pressing on the thoracic cavity, and this then becomes important in terms of how you're going to manage those animals, whether they're going to be in lateral recumbency or sternal recumbency, and we'll see that. And our recommendation and the way that we do it is really to have the animals in lateral recumbency. What immobilizing drugs are we going to use? These are all familiar to you. Whole degree of opioids that are primarily used, etofine, thiofentanyl to some extent mixed with butorphanol, and then the alpha-2 agonists, butyrophenones, that are used in that combination as well as hyalase. And you remember from Dave's discussion this morning what hyalase is. We have a whole variety of wonderful antidotes or antagonists available to us, that when we finished with the procedure, we can wake them up. And here we have buprenorphine, butorphanol, and naltrexone. And there are a variety of drugs and doses and combinations that are used, and you'll see that in the literature, and you've probably been exposed to that at a theoretical level. Any darting system can be used, provided they have got a fairly long, thick needle, and they can actually penetrate a fairly thick skin. So the general tendency is, if you're going to be moving elephants around, that you must relocate family groups. And usually this is done by moving a whole herd at a time. If you are going to be moving individual animals, you can certainly do that. But if you're moving animals en masse, and I'll show you some of the trucks and things that are available, is do not mix family groups. You never put an individual animal from another family group into an existing herd, because they will actually kill that animal in the truck. So just be aware of that. So this is the kind of techniques that were used prior to 93. Many elephant were moved out of the Kruger National Park when they were still running the culling operations. They used to catch and handle the sub-adult animals individually, push them into crates like that, usually roping them. And then after 94, the techniques and things changed. This was really started by a Zimbabwean in particular, in which they moved family groups of elephant out of Gonrozoo National Park, probably in the region of 600 animals out of Gonrozoo Park in 1 year, because of the severe drought that was there. And Clem Coetzee then developed a technique whereby you could move whole herds of animals, or rather family groups of animals, at one time. Prior to that, only sub-adult animals were moved, and then he developed a technique of managing these animals on a more intensive basis in terms of family groups. So this is what it will look like. Helicopter is part of the essential equipment. You can certainly dart elephant from the ground individually, but if you're dealing mass translocations of animals, you need to be able to dart them, find them, follow them up, and then just really helicopter really becomes essential for what you're going to be doing. Here is some animals that are already being darted, one's already down, and you can see that the recovery vehicles are coming up in the distance, and this can be a really quick and efficient process if it's properly organized. And I think that's the one thing that is really important about elephant capture, particularly if you're doing groups of animals at a time, is adequate preparation and planning that has to go into this kind of thing. Everything has got to be organized. Otherwise, you have a operation that is really not going to be successful. What's important is how the animals are lying. We've spoken about the effect of the abdominal muscles on the thoracic cavity. They press up against the lungs. The lungs are unable to expand because the diaphragm is responsible for most of the breathing. So this animal in this particular position is lying on its chest. It's also, to some extent, you can see, got its resting on its trunk. That trunk is partially occluded, and the ability to get adequate ventilation into those lungs is really compromised. And an animal like this, you've got to do something about quickly. Usually, if there are enough people, you can push it over. It's not a particularly big animal. Or if it's lying up against a tree, you've got to chop the tree down, or you've got to put ropes around its horns and pull it over using a vehicle. But it's got to be dealt with quickly. So there's a similar thing on the left-hand side where a big bull has gone down lying on its chest. This would be considered very close to an emergency. You don't want to have that animal lying on its chest for anything probably longer than 10 or 15 minutes. And then you're going to have severe complications in terms of respiration. So what is usually done, as you can see on the slide on the right-hand side, is that people put a little twig or a branch in between the two lips, the flaps of the trunk, to keep that trunk patent. And then you can hear and listen to the respiration and feel the respiration as the air blows past and through the trunk. What other complications can you see? Sometimes the animals go down and they actually, with their actual tusk, they can skewer the trunk and actually damage their trunk. And that you just have to be aware of and see whether that particular hole needs some degree of suturing. It's very difficult to suture elephant skin. It's even worse to try and do surgery on an elephant trunk because it's composed of thousands of little muscles. So hopefully that hole will actually just heal on its own. But it is a potential complication. The other big thing about working with family groups of elephants is just the amount of planning and the equipment that is needed. And this is all private equipment. This belongs to one particular game capture team that are specialized really in terms of moving elephant, and probably one of two in Southern Africa. And these are then big compartments that are put together that will be then recovery vehicles or recovery compartments in terms of elephants are going to be into which elephants are going to be dragged into and then woken up. So this is then one of the processes in terms of how elephants get moved. You've heard Dave talk about using cranes to lift up elephant using their legs. And the same thing is now done with elephant. He explained to it in rhino, and the same thing is now done with elephant, is that the elephant have straps put on their legs. This gets hooked up to a crane, and then the elephants are then just physically suspended, get rolled up either onto a conveyor belt that then gets moved up onto a little field transport vehicle, or it gets positioned onto a truck directly. Okay, so then this is what the older approach used to be in terms of this elephant is now on a piece of conveyor belt. Its conveyor belt to some extent is folded over and secured with chains, and then using a winch, that elephant is then hoisted up onto the field recovery vehicle, and then that gets taken from there to the road transporter. So there's the elephant being moved from place to place. And here we have a situation where those elephants have just been moved directly off the ground with a crane onto a flatbed, still on either on conveyor belting or in a field recovery vehicle, as in the bottom slide. So they get moved from there. Once they're in here, they get put onto the conveyor belting if they haven't been put on already. This conveyor belting then gets dragged into a wake-up compartment like that. Here you have 3 youngsters going in. There at the back is going to be your road transporter. This big crate that has been assembled here is slightly wider than that truck at the back. And it's made to be like that you can have animals lying on their side with legs extended that do not that are not influenced by the width of the crate, so they're able to be moved into that area quite readily. So here you have the elephant in that wake-up compartment. They're just being treated there. Someone is going around giving the antidotes when they're in here. And then obviously once the antidotes have been given to the elephant, then you've got to get out of there quite quickly. And then the compartment doors are then closed. And here you can see a cow and calf that have been woken up from the wake-up compartment or the wake-up crate, and then they get moved into the road transporter at that back where that cow is going into with her calf there. Elephants, strangely enough, tend to move backwards easier than they will move forwards. So that is quite often the easiest way of getting certainly adult elephant to move from one compartment to another, and that is actually to take them backwards. Why? Sometimes you have to deal with individual animals. Sometimes snares and snare removal becomes critically important. Sometimes around the neck, as you can see with this cable. Sometimes one wants to put on collars on animals, and there you've got to treat them exactly as you would if you're going to be doing a standard capture and relocation method, and that works well. And here you can see, if you have a look at that photograph, you can see on the extreme right-hand side, there's your crane truck. At the bottom there, it's got an elephant on the back of the crane truck. It's reversing up against this wake-up compartment crate. The elephant is going to be dragged into that wake-up compartment. And once it's standing and all the doors are closed at the back, and certainly the ones in between are opened, that elephant is then going to be moved into these individual compartments of what is your road transporter here in the middle of the slide on the left-hand side. And you can probably put 3 elephants into each of those compartments, depending on the size, and you can end up with a road transporter that can take 6 to 8 elephants at a time. And this is very commonly used. And this is, in fact, I think, the similar kind of vehicle, in fact, if not the same, by the same operator. And then this was used to move elephants around in Malawi. I think, and Dave can correct me if I'm not correct there. So individual bulls needed a slightly different system. This is an individual bull that's been darted. You can see there the recovery team is coming closer. He hasn't gone down yet. It's easier to work with him once they're down. So the process is exactly the same. Once he's down, you use the crane truck to pick him up, put him onto a sled or a conveyor belt. He gets taken across to that big wake-up crate that you can see there in the middle distance. And right in the far distance on the right-hand side, you can see an individual bull crate that has been developed to handle animals that are bigger in size. It's got a low bed, low bed floor, and that makes a difference in terms of moving big elephant bulls. In terms of the size of elephant that generally can be moved around Southern Africa, your maximum height that you can move in terms of the road transporters that are available and in terms of the height of the bridges is probably about 2.8, 3.2 meters at the shoulder. Big bulls, obviously, in the low bed crates can be taller, but then you need specialized equipment for that. Right, so what do elephants do? We know that they can strip trees. That could have a biodiversity impact in terms of certainly some of the trees there, a Staculia maybe that's been, has the bark stripped off. There's also a very, very clear demarcation between areas that have got elephant in it and areas that don't have elephant in it. And this is one of the camps in the Kruger National Park in which they were keeping roan antelope. And the left-hand side is where the roan were in. And you can see how the bush has survived, and the right-hand side where the elephants have been active. So there's no question that they do play a significant role in terms of opening up vegetation. Whether you could classify them as animals that do bush encroachment management is difficult to say because you need a fairly high population of elephant to be able to do that. The conditions that they get, sometimes in semi-captive animals, you get tusk infections, tusk ruptures, and there's a team of veterinarians that's based in South Africa that goes around not only just to national reserves, but internationally, and treats tusk injuries, tusk breaks, with a proper approach to elephant dental hygiene. And sometimes these tusks have actually got to be moved, in which case it becomes a project or a process that takes a couple of hours. This elephant here on the right-hand side has got some sort of urocele, and obviously damage to the prepuce or the penis, in which urine is accumulating in there, and obviously swelling in the prepuce itself, but also in the subcutaneous tissues just above the prepuce. So these things happen. Abscesses, probably horn injuries from another bull. This is the top of the, just behind the ear of the elephant. You can see there the abscess draining fluid. The elephant on the right-hand side is probably an old snare injury. You can see midway up the leg that there is a constricted area in which there probably has been a wire snare, and then some sort of pododermatitis that has happened to the distal parts of that leg and around the foot, and an opening there through which pus is actually draining. All right, let's just talk about diseases briefly. You guys, we know about anthrax. This is in fact an Indian elephant that has died of anthrax. You know, in terms of the exudation of hemorrhagic fluid, either from the mouth of the animals or from the anus. And that anus, that is classically a sign of anthrax. Vaccination then becomes an important thing, and you can do that under Southeast Asian conditions. You can do that under African conditions. They're easy animals to spot from the air. They're easy animals to dart, and then certainly you can do whatever you require in terms of vaccination with elephants in general. Generally speaking, they have very few real conditions other than anthrax. Anthrax is the major thing that affects populations of elephant. Granted, all mammals can get rabies, but we very rarely see incidents of rabies in elephant. We sometimes get rabies in rhino, but very, very seldom in elephant. There have been some conditions described. There's an encephalomyocarditis virus that's been described in Southern Africa, which is rodent transmitted, in which you have both involvement of the myocard and of the brain, and these animals then die. But it was a sporadic event, and probably no more than 10 or 15 animals died of this. What has been really interesting is something that is called floppy trunk disease, which has been seen in parts of Zimbabwe. It's been seen in the Kruger National Park in South Africa, and probably is related to some kind of virus. But the absolute cause of it is really unknown. You'll see the elephant walking around with carrying his trunk. You can see that the tip of that trunk has completely atrophied. It's unable to grab any grass to pull out. It's unable to grab hold of a tree or a leaf to be able to eat adequately. And sometimes you'll actually see that elephant will go up to a clump of grass and they'll kick it out, and they will get it out of the ground and then actually kneel down to eat it directly off the ground rather than using their trunks to pick it up. Drought is an issue, and there are many animals. Certainly we have a problem in one of our reserves here in Southern Africa, in which we have a massive overpopulation of elephant. There's inadequate food for them, and it just really there's no question that it's probably some sort of management associated influence, and many animals are actually dying. The other thing that we do see that has been recorded and reported certainly in the Kruger National Park is the influence of cyanobacteria, and particularly blue-green algae that occurs on the edges of dams, probably some sort of microcystis. Similar situations have been described in Botswana, but there have been possibly different diseases associated with that particular die-off event. And I think that is me. Any questions that I can answer for you?
Thank you so much, Dr. Richard, for the interesting presentation. We have one question in the chat from Lauren. Lauren, are you able to unmute and ask your question? Okay, I'll just read it. She's asking that, can butyrphone be used as an immobilizer and also an antagonist at the same time?
Lauren, Yes, correct. Butorphanol is one of those amazing opioids that has got both an immobilizing effect, depending on how you apply it. So it's used in combination with azaparone and midatomidine in a combination called BAM, which is then really used to immobilize animals. But it also has antagonistic effects in terms of that if you have an animal that has gone too deep into anesthesia or immobilization, you can actually give small doses of butorphanol and you will actually have an antagonistic effect to the opioid, and you'll end up with you will lessen the plane of anesthesia, and you will actually stimulate the respiration to the point where it's actually more beneficial to the animal. So it is a mixed agonist-antagonist kind of opioid.
Thank you so much. And I can see we have a hand from Dr. Koriwe. Dr. Koriwe, can you unmute and ask your question?
Yeah, thank you very much, Sarah. I hope you can hear me all. Thank you very much, Dr. Richard, for your very interesting presentation about elephants. My question is on the calves, and when you want to immobilize them, how early can you do that and their age, and how do you achieve to work out their dosages? Is this like just by estimating the number of kilograms, or there is a standard dose for calves? And if it's just the same as how to wake them up, how easy is it to wake them up, the little ones? Or there is a certain age where you said you don't do that, or you do a certain age limit? I would like just to know, because I take these guys for pharmacology classes. Thank you.
Okay, interesting question. I think that all animals are immobilized at capture, including the little calves. You will be surprised at how aggressive and how strong those little calves are. So for you to try and go and physically restrain or catch those little calves at a capture event is quite dangerous for you, and probably you'd end up with some sort of damage. So one obviously has to be careful in terms of the dose that you would use. So for example, if one was talking about etolfine for an adult bull, can go anything, up to 18 milligrams of etolfine for a cow, 14, and sub-adults and things smaller. But you really just need to be able to get that animal to the young calf to the point where you can actually restrain it. And there, even 0.5 to 1 milligram of etolfine, for example, will be sufficient if mixed with other drugs. Mm-hmm. Once you've got it then in the wake-up crate, you obviously are monitoring the animal all the time. You're monitoring vital signs, and you're seeing, not only how deep they are, but how awake they are. So you have to monitor the reflexes and then decide, okay, this animal I've given too little because I was afraid of whatever I was going to do to it, and then give it some more. But this becomes really a complete clinical approach or clinical intervention to whatever that combination of drugs are that you're going to be using. But certainly, the antidotes that we've got, as you know, are just absolutely wonderful. And we can use these drugs with the knowledge that if we manage the animal properly, we can wake them up, we can reverse them.
Oh, thank you very much. Thank you.
Thank you so much, Dr. Koriwe, for the question. And we have another question in the chat from Master. He's now taking us to human-wildlife conflict. He's asking what type of fence is the best to prevent the movement of elephant out of the park? Sure,
that is a very, I think, important question, because human-wildlife conflict is a big issue, and it's generally assumed that electrified fences are the best, and they're the easiest to construct. but creating an electrified fence that elephant respect costs a lot of money. There is a fence, for example, around one of our early national parks called Addo National Park in South Africa, in which they built a fence of cables and railway sleepers, and it was absolutely huge, and that seemed to contain elephant. But even constructing an electrified fence around a park does not necessarily mean that you're going to keep the elephants in there all the time. We know that we have breakouts from, for example, the Kruger National Park area, and where the elephant break out, the buffalo go, and then foot and mouth disease follows. So it is a good question, and there is no easy answer. People have created bee fences in which they have beehives associated with the fence all along the route. Some people plant chilies and have chilies along the fence line or around a field where people are growing crops to try and deter the elephant from getting around them. It is of concern, and there's no easy answer to the mechanics of building a fence and what you can do with it.
Thank you so much, Dr. Richard. Dr. Dev?
I just wanted to make two comments. The one thing was, firstly, the fence that you're talking about. I agree 100% with Richard. There's not much that you can do. In many instances, elephants learn about electrics, and they can be very ingenious in how they get through them. But I think one of the fences that I've seen working in Kenya, and it seemed to work really well, and I think it's a method that should be adopted perhaps further south, certainly in South Africa, is where they have the electrified pieces of wire that are protruding from probably about 1 meter or 2 meters high along the fence line, instead of just the standard electrified fence as we know it. And I think it's worthwhile looking at that. And then the other thing was, in terms of the capture, the one thing that certainly the captures I've been involved in recent years have not involved any wake-up box. These wake-up boxes that Richard's referring to are extremely bulky. They normally come in 3 sections. They're difficult to transport, and once you put them up, you can't move them until you've broken them down, because they're just too wide for conventional transport along most of our roads in Africa. So what has been developed over the years now as a method whereby an elephant bull, as big as you can get, can be transported or loaded into a transport vehicle simply by keeping them suspended with a crane, very similar to the rhino, except this way is not upside down. They are actually suspended with ropes underneath their armpits, the back legs and the front legs, and then swung literally into the back of a truck. And once they're in the truck, they can be gently lowered onto the feet so they're just touching, and then an antidote can be given. Works extremely well. It's also very efficient in the sense that you can do plenty of elephants in one day. I see there's quite a controversy in Malawi at the moment with Kasungu National Park. It's I think they moved 200 odd elephants there in 22, and you'd only be able to move those sort of numbers if you had a very efficient means of transporting them and capturing them.
Cool. Good. Thanks, Dave.
Thank you so much. Before we move on, we just have 2 questions, and I think we can just take them briefly. There is one from Joshua who's asking you to expand on the blue-green agar issue in connection with wild birds.
Joshua, I have no knowledge of blue-green algae transmission or involvement with birds. As far as I know, birds are not affected by the cyanobacteria. I speak under correction. I have no specific knowledge of birds with blue-green algae.
There is one from Aaron who says, do you encounter snake bites with the elephants? And what is the approach?
I have never heard of an encountered envenomation with elephant from snake bites. Most snakes tend to get out of the way of elephant if they can. Their skin is also quite tough, so even if they do have a puff adder or something that strikes at them, it's unlikely that the fangs of the snakes will actually penetrate the skin. So I would imagine that the venom is just deposited intradermally, excuse me. So I have no reports or have no knowledge of snake bites with elephants.
Thank you so much.